So, this is my update. It is, I believe, the 9th of November now. I just wanted to give everybody sort of an update about what happened with me medically. Basically, I had surgery. Oh, there I go again, using the word basically. I was trying not to do it anymore. But anyway, so I had surgery on the 4th of November. It was kind of sudden. I had been originally planning to have surgery the second week of November, but I had some preliminary testing done to track my veins in my arm because we have a major artery that runs through your arm, and the doctor had to check it to make sure that when he was in there that it wasn't at risk of being nicked. Obviously, that would have created a bleeding problem that we didn't want. But anyway, the doctor did the assessment and basically said, yeah, let's go. So I got a call from the hospital saying that they wanted me to come in immediately for surgery. And it was several days sooner than I had expected. I hadn't even followed up with the doctor yet on what I was doing. So I went in on the 4th, the morning of the 4th. Went in really early in the morning. We had to be down there by 6 a.m. and they admitted me and got me all situated. The surgery was scheduled to last about 6 hours, which is probably one of the longest procedures that I've ever had scheduled, where the doctors said this is how long it's going to take to do. The surgery itself actually only took about 3 hours, give or take, which is phenomenal. That's absolutely fantastic that they only took that long. That means that there wasn't any complications, and they felt that it was quicker than they expected it to be. What I had done to kind of explain it to people a little bit is I did have a total elbow replacement put in. For those of you not aware, this is actually my 6th physical full joint implant that I've had put in the last several years. I had my first one put in 2004, and I've had this is the 6th one since. This is my 3rd upper body implant. I have a full kneecap done. I have 2 full hips completely replaced. I have both my shoulders replaced, as I have said in past videos, and now I have the left elbow replaced too. It's kind of a nice homogenized balance between everything. But what the doctor did is there are three bones that make up your arm joint. The ulna is one of them, and there's 2 others. And you basically have 2 bones in the lower half and 1 bone in the upper half that connect your joint, okay? In my case, all 3 of those bones had basically fused together in a curved position. My arm was curved up in a 55-degree angle, and the bones had calcified and, due to trauma related to my illness, had fused over. And so what the doctor did is he went in along the edge of those 3 bones, which were all one piece at this point, and he basically cut out a section of the bone in the corner of the joint and took all of that out and replaced. So he essentially separated the 3 bones and put in a metal rod into either side, and then put in the head of the joint, which is usually made of a ceramic or a plastic. I believe the incision is actually on the far edge of the joint, so it's on the back side of the bone. That was replaced. I was stitched up. And from what I understand, we had worried about bleeding. In all the past surgeries that I've had, I've always needed a blood transfusion. I did not have to have one this time, which is really, really exciting and odd that I wouldn't have to have one. I barely bled, from what I understand. In fact, they were planning to recycle my existing blood that I lost back into the arm, which is something cool that they can do now. And they realized they didn't have to do that this time because there was such little blood loss in the arm. So they were nowhere near any of the major blood vessels whatsoever. They patched me up. They put me in a big, they wrapped my arm all up. I actually have a plate on the outside of the cast, or kind of like a cast. It's like a soft cast to keep everything in place. And then I was put into recovery. And I can kind of show you a little bit of what it looks like. Now, mind you, I'm all bandaged up, so you can kind of see. You can see the bandage and how it goes all the way up my arm. Going on my fingers. See, look at that. Awesome. One of the things I was really excited about that didn't happen was they were worried about nerve damage. Whenever you work in the upper extremities, there was always a risk of nerve damage in the hands. I did not, far as we can tell, I have not sustained any nerve damage, meaning I can move all my fingers. I have actually better feeling in my fingers than I did before the surgery. So it's actually improved the circulation in my arm, which is super, super exciting. What was so peculiar when I came out of it, because I have a tendency to come slowly out of anesthesia, and I tend to sleep for a lot of hours afterward. For the first 12 hours, I pretty much slept more or less all the way through. Woke up a little bit here and there just to let people know I was alive, but I pretty much slept most of the time through the process. But the thing is that is so strange is people have to realize that my arm has been up basically like this over my chest for a good 10 to 15 years, okay? And I could wiggle my fingers, but it was stuck up like this across my body. And I have to say that when I woke up fully out of surgery and I was back in my room resting, I couldn't feel anything. They'd put a femoral block in my shoulder so that I didn't feel anything in my arm all the way down. It's kind of a cool thing that they can do now. In a lot of cases, I've had femoral blocks in the past put in. So basically, I'm used to being across like this, right? Well, when I woke up, my brain had not caught up to the fact that my arm wasn't up here anymore. So I really had sort of an out-of-body experience for the first several hours where it took me a while to realize that my body had moved down, that my arm had moved down into the position that it was in. My hand was actually in my lap, where it should be, instead of up across my body. And I have to say, I knew logically that was true, and I knew that, but it took me a while to mentally adjust to the fact that it occurred. I didn't believe it. It literally phantom-like I felt like it was up here. I couldn't believe that it was down at first. And you gotta remember, it was numb all the way down, so I couldn't feel anything all the way down to my hands. And I had this amazing moment when I realized that it was down in my hand. I can't even describe it to you, where you really feel like your body part isn't a part of you in the moment because you can't feel anything. So it is literally separate, but it's warm to the touch, so you know it's still attached to you. And I had this situation where I woke up and I took my hand and I kind of followed my shoulder all the way down to the bottom of my hand where I dug around in the blankets until I found my fingers. And I had the experience of holding my own hand in my lap. And it was so strange because it was like a foreign arm. It was like somebody holding someone else's hand that was limp. And I knew logically it was mine. I knew it belonged to me. I knew it was part of my body, but it was so separate. And it was a surreal moment of coming back into myself because I'm so used to having a disassociated attitude about my arm that suddenly here it was. I could feel my pulse in my arm. I could feel the blood flow. I could, even though it wasn't able to move yet because it was still numb, I found myself stroking my hand and bending it back and forth, and it was bending back and forth like it should. And I was afraid at first because it was kind of at a bent position. I pushed it down so it was as straight as it could go without too much pressure because I was paranoid for a second that if I kept it at a bent position that it would stay that way, and I didn't. When it stayed that way for 15 years, it's a big deal to move it down. And I just bonded with my body part, and it was really, really surreal. I can't explain to you how miraculous it was to touch on a piece of my body that I was experiencing in a normal capacity for the first time in decades. Okay? More than any of the others, this one was the most dramatic for me mentally. And it's like welcoming a piece of yourself back to you. It's like having a piece of yourself returned to you, and it was a very emotional experience for me. I sat and I just was so happy. I was so happy, and I cried by myself. And I just kept stroking it and squeezing my own hand and reassuring myself that, hey, I love myself and I'm happy that it's back. And I couldn't even believe it. And actually, truthfully, overall, I mean, it hasn't been super painful, I have to say. I am on some pretty heavy meds for it if I want to take them, but I took what they gave me in the hospital every couple hours when I was allowed to have it, but beyond that, it doesn't hurt. Like, of all of the replacements I've had put in, this one has hurt the least, which is shocking. And I do have movement on it. I'm not trying to move it too much because I know the doctor wants me to keep it immobile. I haven't had the bandage changed yet. It's going to still be a few days, so the doctor wants to really give it the biggest opportunity it can to heal before we start fiddling it with physical therapy. So, but it basically went from being cocked up at a 55-degree angle. I went from having maybe I think maybe 80 degrees of internal down to 180. So it literally, I don't know if it's ever going to be completely straight, but I tell you what, it's pretty equalized to the other side. It's actually, I was sitting there and having them in my lap, and the left side, which has just been operated on, actually felt longer than the right. And actually there was a little bit of shortening that happened on that side. So to mentally feel as if that arm was actually longer and that it was actually able to reach out farther than my good side, is pretty mind-blowing. It was pretty phenomenal. And I had pretty good feeling, even though it's still really weak, obviously, because I've had the implant put in. The muscles were really good. There wasn't a lot of shortening of the muscle, ironically, that they expected. So it was actually pretty well intact. The muscle was very strong on both sides, and the arteries were out of the way. They were able to tuck those back where they're supposed to be along the inner lining. They moved them so that they're more on the inner lining of my arm. And I don't know exactly what the prognosis is going to be for physical therapy, but in truth, I don't really see any reason why I wouldn't gain at least the basic strength that I had in the arm originally. I might not be able to bear weight like I was doing on that side, but I will certainly eventually, with physical therapy in the next several weeks, possibly be able to go back to driving like I was and everything. It was strong to begin with, so I think once it wakes up and it heals fully, there's a really good chance that I will not only have more movement, I definitely have more movement. I have more movement now than I've had in almost 2 decades. I mean, it doesn't hurt. So I just can't even begin to explain. So I'm back at my parents' place in recovery. I stayed in the hospital 2 days, and I was eating solids that night. They had me on a liquid diet the first night, and I literally was chowing down on a. They were nice enough to bring me up a hamburger, and I was literally chowing down on food and solids, and my blood pressure was really good all the way through and everything. So they basically were happy enough to let me go the next day. I went home in the evening around 6 o'clock. I will be staying at my parents' probably for the duration of the month, maybe even 2 months, just until I really probably wouldn't be good to go home until I absolutely know that I can start driving again, and I don't know how long that's going to be. I probably won't go more than a month and a half of being with my family. I'll probably go back to my apartment, and we'll just work out carpooling until for my classes that start in January, until I'm competent enough to drive physically on my own. But I'm just really excited, and this surgery has far exceeded my dreams. It really has. It is exactly what I wanted. It is exactly what I hoped for. It's the reason why I decided to do the surgery now was I'd always planned to do the surgery eventually, and I had had doctors give me sort of a runaround. I had many people that were afraid to operate on me. It was a very complex case and obviously very scary to a lot of surgeons, and they were really afraid to take on my bone structure and do it because they were afraid of the long-term consequences of doing it. These implants in the upper arms are only good for maybe 10 to 15 years at best. My goal, I told my doctor, I said, my goal is not for them to be good forever. I would like to get as much movement back as possible. I waited 10 years to do it, till the technology was better and till people were more confident with it. And this is time for me. I want to be at my best, especially during these years when these are the next 5 and 10 years are when I'm going to get married, when I'm going to have kids, when I'm going to do these things, and I really want my body to be at its optimal. And frankly, if it putters out after that, I don't really care. I don't really care. Because I will have the few years, especially during when I start having kids and raising them, I'll have the years that I wanted to have with them at the best. And so, frankly, if it goes after that, I really don't give a damn. Honestly, I really don't. I'm perfectly happy. I have to say, for the first time in my life, I really feel biologically complete. I feel like this is the best they'll ever be, and I don't really feel like I'll be seeking any more massive surgeries after this. Any surgery that I have after this, like to repair the kneecap that really didn't work out for me so well, and other things, those things will be more maintenance surgeries from here on out. Unless I have a major injury or a major setback, I don't imagine that I'm going to have another major surgery related to the joints again. That could change, but I'm pretty satisfied now. So it's gone well. I'm in high spirits. It was an absolute wonderful experience to be in the hospital. I love being in the hospital. Everyone treats me very well. I was very happy. U of M is one of the best hospitals to have this sort of stuff done at. Um, and overall, I'm happy. I'm happy, I'm healthy, and I'm doing really well. Uh, I'm still kind of tired. I'm sleeping a lot still, but I should be able to start seeing people and maybe going out a little bit this weekend, and we'll just take it in stride. I've done this. I'm a veteran at this. I've done this a lot of years. I know what to expect. I know how to take care of myself with it. But I will keep you updated. And I will let you know, just to FYI, I will talk more about it later, but I did hit my NaNoWriMo, my word goal, before I went into surgery. So look for an update specifically on that later. Alright, I love everybody. If anybody wants to call me, and they can get a hold of my parents, or they can find me on Facebook, those who know me and want to speak to me in person, please don't be shy about coming and visiting me or sending me well wishes. I love everyone. I'm grateful for all of the well wishes and the prayers and the support. This has been a long road, and this is the end. This is the end result of 15 years of concentrated work to better myself, when they told me that I would never be remotely like I am today. They said I've had for years people tell me that I was pretty much doomed to be paralyzed from, the chest down, and here I am. I am walking, I'm moving, my joints work for the most part. Um, I, God has graced me with the ability to fix and to cope with what wasn't able to be fixed. And I am grateful. I'm grateful. And I love everyone. So, okay. So, here's the update. Again, it's November 9th. You can expect several more videos in the next few days. I want to make up for the days that I didn't post videos. Most of the other videos will mostly be me talking about NaNoWriMo and some other writing-related things. So, hi, everybody. It's exciting. Be excited for me. I'm very happy. I love you all.